I'll start with Nadia. You can talk a little bit about your experience, especially in the public sector around AI and what you think it's going to do in the next 3 to 5 years in government.
We're finally at a point. So we used to call something in public sector, why can't government like an Amazon, like an Airbnb, why can't I have an experience with government like I do like one-click services with all these other commercial companies? And I feel like we're finally at a point in time where we actually can provide streamlined services. So just coming from my own government background, like at the county, let's say if you as a resident of any city, you're trying to pay for your property taxes, you shouldn't have to know, do I go to the assessor's office or do I go to the treasurer's office? They both collect property taxes. So from a frictionless standpoint, how can we make these services super easy for anybody to access? Whether it is 99% of the time, nobody wants to walk into a brick and mortar government building. Example, getting your driver's license renewed, right? Paying your bill, your utility bill. These are such heavy lifts for like any of the residents that they're like, ugh, you know what? I'm gonna have to put this after like 5 p.m. because my day is so busy. But guess what? After 5 p.m., government is shut down, so you don't get to talk to anybody. So you have to wait till 8 a.m. next day. There's little self-service, knowledge-based kind of use cases where now I'm seeing finally get sticky in government. Where like we have petabytes of data that we're collecting. And we have, let's say Furkan is coming in and he's trying to apply for a business license. So by the way, Furkan also complained about a pothole the other day. Oh, and by the way, I also want to apply for my kids for a safe key because they need to go to summer school. All those things should be personalized for him. Why should he have to log into 9 different portals? So I'm seeing a lot of those frictionless services from a tech standpoint about providing this integration in the back end and providing the service to our community to make it super easy for them to have this chat GPT type of experience. So I guess all of it in a nutshell, what I'm trying to say is where we're at right now, the next, I hate to even call it 5 years because I feel the next year is going to look drastically different. We're talking about agents. We're talking about agents in the flow of work. Somebody who's going to be your digital buddy, who's going to be able to help with a lot of these mundane, repeatable, manual tasks that you kind of tend to do right now in spreadsheets. But let's allow for this digital buddy, this agent to be able to do that work for you. So I feel the next year alone is just going to look drastically different from a public sector, government, even education perspective.
Do you find in the government people are willing to change, not to,
I will say the top 20, 30 cities, they are looking to innovate.
yeah, good.
And a lot of the medium to small sizer cities, they're just looking for somebody else to do it first because they are very risk averse, right? That nobody wants to be the first. But I do feel there is finally adaptability to come and learn. Everybody
Yeah,
wants to host an education
yeah.
day. And I feel like education helps. Like, who else is doing it where I can gather there where they failed, what's good, what's bad, what's ugly, tell me about it, and then I'll pick the risk averse use cases. And I feel like that translates well into healthcare, which is also a very heavily regulated market.
Yeah, and I think a lot of folks, especially in government, fear that if they don't, well, they may be moved out of their roles because it is
Right.
obviously very prevalent in what's going on. I'll go Fatima next. How about in your field? What are you seeing and what do you think is going to be happening in the next 3 to 5 years?
Yeah, so I mean, especially with clinical medicine, I think most physicians tend to be really conservative in the application of technologies, but there's a lot of different hands in the healthcare space. And I think that's exciting because there's a lot of opportunity for innovation, particularly in dermatology, which is so image-based, and there's such a need for more dermatologists. Questions about whether or not these technologies can improve access to care, which I think is possible. But I think one of the things we have to be really careful about is looking at some of these technologies and make sure they're actually doing what they say they're doing and making sure that they're being evaluated in a very rigorous and scientific way. Because there's a lot of different competing interests where, people are really trying to find a way to help the bottom line, I think is the best way to say it. And so one of the things that like I have taken on for myself is to make sure that when technologies are rolled out in the clinical space, that they are safe and effective. And those are really, really important terms. And so I think one of the places where AI is doing really, really well in the clinical space is things like documentation, things like simplifying patient-facing documents, basically in communication. But when it comes to actual, say, clinical triage for dermatologic lesions, diagnosing dermatologic lesions, I don't think it's doing so great there. I think there's obviously a potential, but I think that's where we have to think a lot more before we apply
Is
it.
it because of the risk factors, right? Yeah.
Because I think, it's going to look at the pretest probability. And when you look at a mole and 90 out of 100 moles are going to be fine, that's okay. And then maybe 10 of them are going to be melanoma. But if you end up being that 1% where it chose the wrong thing and you didn't have clinician oversight, that's going to be a problem for that patient, right? And so a lot of it is really, right now, they're doing a lot more like these direct to consumer AI tools of like, you can check your skin. And when we test them, we realize they're actually not that effective. But I think the areas where I've seen it be very, very useful is again, these types of things where it's like the note bloat, the death by 1,000 clicks, the EMR, so that physicians are actually able to spend time with patients rather than spending time documenting. I think that's where it's most effective at this moment.
Do you find, and this is just off the cuff, the insurance companies like malpractice, are they starting to add language where they include clauses that if you do use AI to, to do something that they're not responsible for or something like that?
Well, yeah, I mean, because any AI tool that is deployed right now, right, ultimately has to have clinician oversight or like there is a clinician on the hook for that, right? That's a huge question or topic that people have been talking about AI applications. If we do make any of these tool autonomous, like who's on the hook? Because you really put a tool on the hook. But what I'm realizing is, they are starting to create like reimbursement schemes, like for example, within pathology, just because dermatology can be very closely related to pathology, because one of our subdisciplines is dermatopathology. If someone uses an AI tool, like they can bill and code for that. But the question becomes, the physician is ultimately responsible, but as these tools are getting more and more effective, how can that language and the way that we kind of do our disclosure about it change? And it's also, the data that's being fed into that. What are the understanding of the institution, of the patient, of the clinician, of how that data is being used? So I think there's a lot of moving parts, and it's kind of exciting that we get an opportunity to help shape some of how this is actually going to be implemented.
Rohit, you're up.
I would answer the question from like a couple of different levels, just specific to my field of neurosurgery, where we're seeing AI really take off is in ways, AI really refining our surgical robotics technology, allowing us to place instrumentation in a much more precise manner than ever before, in a more efficient manner that's going to continue to evolve. I think that there are technologies in the not too distant future, specifically me as a spine surgeon. I would love to see, exoskeletons allow patients to kind of align themselves in their body posture more effectively and lead to better healing after the sort of surgeries that we perform. From a broader medical perspective, and partly echoing some of what Nadia had mentioned, really having AI serve as like a patient navigator because, just as it is complicated, getting your driver's license, it's also complicated filling out health forms, going to the clinic, knowing which doctor to choose, knowing where you are in your cancer care, how to even navigate some of these My chart websites can even be complicated, finding the right notes. And so I think these are areas that we can see benefits from with the technology that we have today, with just with a little bit of tinkering.
Khan.
So it's neuromodulation or brain-computer interfaces, and what we generally do is we record, brain activity from patients who have different conditions like epilepsy, Parkinson's, depression, and the hope is that we can tailor treatment or we can make these conditions improve by looking at their brain activity patterns and then maybe trying to manipulate their brain patterns based on what we find. And so there's a lot of exciting research that's going on in this field, a lot of stuff that has been done in academia over the past, 20 or so years. I work in the epilepsy space right now, and the hope is that you can look at the brain patterns of these patients and you can try to find biomarkers of what really happens when these patients have seizures. And then you find some predictive biomarkers that if you find a certain type of a brain biomarker, do you have some probability that your seizure might occur next in the next few days or something. And so the field is trying to move towards that you develop these personalized biomarkers where you can either predict or react to certain types of brain patterns that appear, and you can try to modulate their brain activity so that they get better. So it's very exciting in that sense. But I think one comment that was made earlier really makes sense, that we really need to validate these biomarkers and these pipelines rigorously. There's the one thing that you get 90% accuracy or 95% accuracy on a lab-built model, but when you deploy this in real world and your patient populations change, sometimes your model is just not trained on the representative population, and so it just fails miserably in real world. And so there is definitely research that needs to be done, proper rigorous research so that your models and your AI works properly across populations. And I think there is work being done in academia towards it. And there are industry partners that are also working in this domain. Exciting work is happening, but we need to be careful what we are deploying is actually working properly and not just. We need to be aware of all the failure modes that these models have, like hallucinations and those kinds of stuff.
Do you think within the next 3 years we'll get there, or do you think it's going to take more time?
I think we can. And yeah, I think I didn't answer that part of your question. In the next 3 to 5 years, there's a big push towards personalized medicine. And so I think we will see, like we're talking about these agents or chatbots, like maybe physician facing chatbots where you have patient data from different patients, and maybe you'll have models which can look at all of the data corresponding to a particular patient, and then maybe give you some recommendations that based on the history of this patient, maybe you should do this next with this patient. And of course, a lot of, as I said, rigorous research needs to be done so that these models they don't have a lot of failure modes. But we are moving towards that where you have these AI agents helping physicians tailor therapy based on what the past data tells
The
them.
next question I have is regarding, well, it's ethics in AI, but I'll include anything you think are barriers in terms of privacy, security. But I'm very curious if it's been a topic in your respective realm. Some of you probably see it much more than others, but Nadia, you want to start and talk about what you've seen with respect to ethics, whether it's compliance, security, privacy, or other biases that you've seen and ways to overcome them?
All the above. One of the biggest questions I always get from people is like, okay, I know which use cases I can use AI for, but which ones should I not use them for? And I always give this one example. So back in 2022, when ChatGPT first came out, I had uploaded my selfie, I gave my background. I was like, hey, this is what I look like. Based on everything that you know about me, what do you think I look like? And it kind of knew a lot about me in terms of information. My background's in tech. So guess what it came back with? It imagined me, based on all the conversations that we've had, that I was this bearded guy with glasses and a suit and a laptop, but completely like it thought I was a male of a male genre, basically. And fast forward now, I did the same exact prompt. Now we've
With
been
a name like Nadia, that's very fascinating.
Exactly. It was ignored a lot of different things when it came to, but it just looked at basically when we're talking about demographics and population
Yeah.
and where the data is being pulled from. I just found it fascinating. So fast forward now 3 years, I did the same prompt. We've been having conversations now for the last 3 years. So imagine I would assume that the data is getting a lot better and getting to know me, providing that personalized stuff. 2025, I did the same thing in December of last year. And I was like, hey, what do you think I look like now based on everything that we've had a conversation with? And it's funny, it came back and said, you know what? I actually don't know enough about you to describe what you look like, despite me putting 10,000 pictures as part of our conversations, right? It's just interesting, I guess, where when we're talking about bias, I always bring up use cases like, for HR, when we're doing recruiting. How does that show up, especially in government? Because government has very specific rules around recruiting, and we got to have X amount of, diversity being part of that. So those are probably not the best uses because I feel AI is not quite there yet when it comes to inherent bias. Or it's like especially as it's pulling data from maybe Reddit threads and all this public information that's out there, it's trying to do the best it can in providing you with what that could look like. So when it comes to good use cases, I would say anything to do with some of the basic stuff, like what we're doing right now with summaries or providing information. The generative part of it is actually quite good. Where it gets really tricky is when we start talking about agentic. Agentic is fully autonomous. I don't think we're quite there yet in regulated market, but you still need that human in the loop layer to be able to do the vetting portion of it,
So you
just
think
because
agentic, is it more risky in terms of ethics and compliance,
it
right?
is.
Yeah.
It is. We're not quite there yet. If you're a Home Depot, if you're like a big commercial organization, yes, you can make mistakes and get away with it. But when you're a government, when you're in healthcare, when you're in education, when you're in a very, very risk averse, public facing, very visible sort of field,
Yeah.
you cannot make mistakes because you are going
Yeah.
to show up in the paper.
How about you, Rohit? What do you think?
Well, I feel like there's so many different ways we can proceed with this question because in our own work, we've dealt with so many ethical issues as well. But just giving an example, in our field, there was a study done by a large health system where they used a sort of medical specific large language model and they gave it to the neurosurgery residents and they said, hey, can you use this as you're getting consults in from the emergency room from neurosurgical emergencies? Can you use this model? We want to see kind of how you do when you use this model versus when you don't use the model. And what they found was that they had an abysmally low utilization rate, less than 2%. It, turns out when you're getting a call about a major head bleed, the last thing you want to do is take a picture, a screenshot of that head bleed, put it into a large language model, wait for it to think, and then tell you what to do. You already know what to do, like as a surgeon, like how to address that, right? So we need to separate out, and of course, you can make the argument it's leading to a delay of care, right? And so we need to separate out where are these use cases going to lead to harm, or where could use cases of this technology lead to good? You may use it in an ambient fashion and maybe in a spine surgery clinic where maybe it's listening in and saying, hey, maybe this is an atypical presentation of ALS as opposed to a disc disease, for example. And so figuring out how to deploy these tools is just important as the tools themselves.
Fatima?
Yeah, I totally agree with everything that's been said so far. And actually, to Nadia's example, we actually did a study kind of similar where we actually asked these text to image models to create, we said like a photo of the face of a blank, and we just described different types of surgeons, and it would basically produce an image. And out of the images it produced as compared to like what the training workforce is right now or the current workforce, it basically produced all Caucasian and all white men. And like, does it really matter? It's producing that? No. I mean, like, the point of the study is not to say, oh, like, when you put this prompt and this is what happens, but it kind of speaks to the underlying bias of what these models are doing. And so they could be doing that for the workforce, but they could be doing that for our patients, right? Because he was saying how the BMI scale was developed on Caucasian race participants only, but got applied across the globe in clinical practice. How do we ensure that the data fed into AI algorithms is all inclusive and not biased? I mean, that is really getting the heart of the issue. We already do a not so great job at making sure our data is really, really well balanced. And now that's like, if you have garbage in, you get garbage out. So we not only have to like go back to the drawing board for our own data that we've been used to train, but as we train these new models, especially as they shift, we want to make sure that they're really comprehensive. And for someone specifically in dermatology, like if your skin cancer algorithm only has either fair or darker skin types, then when you feed in something of the opposite, it might not be able to handle it. So I think one of the biggest barriers is making sure that the data sets that we are feeding in are really reflective of the patient populations in which it will be used. But I think that it's a solvable problem and one that, as long as we're aware of, is possible to solve.
And Furkan, anything to add?
Yeah, just I guess a couple of points. I think you mentioned the ethics perspective. There's a special angle there in the neuroscience, computer interfaces field, and even neurotechnology in general. So there are like these neurotechnology devices which measure your brain activity from the outside for consumers, and they will tell you, how much focus you're having, or if you should do something else based on your brain activity right now, and that kind of stuff. Like consumer variables, but for brain. And so that raises an important question of brain data ownership, because that's basically your brain data. And then people have gone to extremes that it's basically your thoughts could be decoded from your brain data. And that's kind of possible. People do it in clinical settings, but even in general, that's, possible. And so there needs to be regulation around that. Whatever consumer brain data that you are generating and giving to these companies, how is that data regulated? And you should have ownership of that. And it should not be just sold randomly, just like it generally happens. So that's an interesting perspective. And then about bias, I think it definitely makes sense. Like in the clinical settings, as I said earlier, we need to train these models and develop these models by keeping the overall patient population in mind. And so representation matters there. Otherwise, if the model has not been trained on a big majority of the population, then it will just fail on certain categories. And yeah, and we are discussing failure modes here. I recently found an interesting example at a conference that I wanted to share. So I went to CVPR recently. It's a computer vision and pattern recognition and AI conference. So a lot of vision, medical AI related work was there related to computer vision. And they talked about sycophancy there. These AI models, large language models these days have a tendency to just agree with the user. They showed an example, someone uploaded a scan of something and asked, what do you see from the scan? And the AI model said that it looks. So then the prompter said, actually, I asked 2 or 3 radiologists and they said that it should be this. And then the model said, oh yeah, you're right, it should be this. So there's this one other failure mode that the language models just tend to agree with what you say and they don't have independent thinking of their own to a large extent. And that needs to be taken into account as well. And basically more research needs to be done towards that so that
How about
we can
trust?
really,
Does it create trust issues when that happens? How do you overcome that,
I mean, a lot of clinicians who are reluctant to, incorporate these AI tools in their workflows. This is one of the reasons, or this should be one of the reasons. There's not much explainability as to how these models, large language models, are making their decisions. It's kind of like a big black box, as we talk about. And so, yeah, we're not always sure why some decisions are being made. So more academic research needs to be done around that. We need to consistently validate across large populations and see if these tools are working generally well, consistently for a large period of time, and then we'll be.
I kind of agree because reliability and consistency is so key and instrumental that if you don't have it, and the problem is we haven't had AI for all that long. So, we're doing it now, right? And so for those of you who are old enough to remember when the World Wide Web became a real thing, like people started using it and really understanding what it did and putting the information, like if you remember, even like setting up a bank account online for those who were, I mean, it was risky, scary, but people who did it were fascinated by the fact you could even do that back then because everything was mail paper. And so now obviously it's like you don't even think twice, right? Like basically, I'm sure everybody on this call has everything is online. And I think AI is going to be the same thing where the more people can trust how reliable it is over a consistent period of time, I do think that'll help earn trust needed to really explore all the depths of what AI can do. And I know there are different forms of AI that haven't been released to the public for that very reason, right? Because they want to make sure that it is trustworthy and that the things that are in there are things people cannot manipulate in any way. Fawad, you asked the next question.
Yeah, sure. No, great discussions. I think of us looking at this from sort of the public fear standpoint, right? So there was one that came out more recently, like we're going to lose our jobs. And then we were able to assuage those concerns where we started to realize that it maybe even opening more jobs because now the expectation is to become more efficient. So it's pendulum is going in the other direction. But I think where we still need to scratch our heads and some an ethical debate the potential de-skilling, right? A lot of us are involved in academic endeavors in some capacity, and so we have folks we train with and those who look up to us. Where do you think this will land from a professional standpoint in this pursuit of taking over our skills, or maybe just even compromising that from an academic standpoint, and what that means for the future, just in your particular area, for instance? So. Burkhan, what do you think as you're leading your team at NeuroPace, bringing on juniors?
Yeah, sorry. For the last later part of your question, you were asking like how I guess the jobs and the roles would be affected. Is that the main question?
Yeah, and then do you see a level of de-skilling, right? And so when you're training and AI is doing all the thinking for you procedurally, do you think that's going to become a problem with just human talent?
No, I think it's basically the way I see it is it's like a boost in productivity. And we've seen a lot of that, even in my work in Europace. What used to take months previously now takes days or even less. And so it's a massive productivity boost if you know what you're using and if you use it properly. I was having a discussion with someone that right now we are kind of like acting as verifiers of AI outputs. I think that's mostly what we do. So like we basically ask AI to do stuff and then we are just verifying the outputs that what it's saying makes sense and then we can use it in our workflow. So a lot of our workflows are like that, and which is a good thing, increase in productivity. And I guess regarding like job changes and impacts. There's this interesting example of Jeff Hinton who said very like, I don't know, 5, 10 years ago that radiologists are going out of jobs very soon. And that did not happen. And I think it's not going to happen anytime soon. And so I think it's basically humans are here to stay in the loop for now for some time. And it makes sense, at least in the clinical context. And the good thing is that we are just going to get our workflows more efficient by using AI. So we will basically incorporate all these workflows in our settings, but still be, we'll still be in the loop and we'll be kind of overseeing what AI is doing for us and then, managing patients in that manner.
That makes sense. And then, as a parent, I certainly see the value of dermatology in our family. But what would you say, Fatima?
Yeah, absolutely. I mean, this That's such a great question because something that we've been grappling with as someone who is currently in academics and is am going to be faculty training, my own medical students and residents. It's something we think about a lot because, for example, one of the main things we do as part of dermatology training is we do something called like grand rounds. And for our grand rounds, we have patients come in who have they're not supposed to tell you anything. All you're supposed to do is examine their skin and you're supposed to come up with this really wide differential. And I remember, the faculty who have trained me said, we would come up with kind of a list of inflammatory, infectious, and now you give that same kind of case to like a PGY2 resident who just arrived, and they come up with this incredibly sophisticated differential. And the question is like, right? And it's true, like people are using AI to come up with these differentials. And does that lead to some level of de-skilling? Does that change the way that we can actually process and think about what are these different aspects of the diagnosis in front of us? Now, I think it's tough because, it's one of those things when the internet came about, right? Or when people are using computers, like we don't not use those as part of our clinical practice. That becomes commonplace. I think it's still important for us to be able to train folks, both who are currently going through training, but also through continuing medical education for those who are already out in practice, how to use the AI tools. It will make us change the way we evaluate and assess competence in our fields when these AI tools are already so available. And so, like, there's become questions about should our examinations be kind of like actively responding to the way that someone's answering the question as they're answering it? Do our testing tools need to be more sophisticated to ensure that someone has reached a specific level of clinical competence? It's a hard thing to answer, but I know it's something that, especially in the academic sphere, a lot of people are thinking about and talking about. But I think there is the risk of de-skilling. It's just something that we have to continue to find ways to counteract.
I agree. And Rohit, do you see the same in sort of the Boston,
Yeah.
the hub of the educational milieu?
Yeah. When it comes to the skilling question, the question, the viewpoint I use as like my guiding, like Northern Star, what ultimately is going to be better for the patient at the end of the day, right? In our field, over the past 20 years, there's been this enormous debate using image-assisted, navigated assisted placement of screws in people's spines. And so the traditional way that surgeons place these screws was what's called a freehand. They're just looking at the anatomy with their eyes, and based on their experience, this is the trajectory that the screw should go to be placed adequately in the patient's spine. Now we have technology that it's like GPS for the screw. You know exactly where it's going. You know exactly where the nerve root is, exactly where the spinal cord is, and you can place that screw. People say that having trainees exclusively use that technology means that there is going to be a possibility of trainees coming out to the world not knowing how to do it freehand. But if at the end of the day, this technology means that less patients are getting hurt, isn't there an ethical obligation to use that technology and make it available widely? And so that's kind of the tension that I view in this deskilling issue. I think we have to remind ourselves what is the ultimate goal here? It's to provide safe and effective patient care.
Yeah, makes sense. Absolutely. And I do you see the same happening in, even in industry or the public sector?
Yeah, I'll give more of a kind of like a tech perspective. So what I'm seeing is we're kind of positioning all of this as augmentation and not replacement. Because especially in the public sector, if you start talking about replacement, people freak out. We're talking about unions getting involved and it gets very complicated. So I think that's one. And two, we're really talking about the new jobs that are being created. As an example, AI ethicist never existed before. Now we have AI ethicist roles. Forward deployed engineer, that used to be only by Palantir. If you ever followed Palantir, bought the stock like 1,000 years ago, well, congratulations if you did. I wish I did too. But the point being, forward deployed engineers was just something that didn't exist. And now in the tech realm, you see this kind of role all the time, which never existed before. Again, so we're going to see a lot more. Sometimes we focus so much on what we're going to be missing out on or what replaced, rather than well, kind of let's balance it out by seeing well what new stuff is being created because of it, because it never existed before. So I feel that's the momentum, at least what I'm seeing on the tech side of the house, and that's how we position it with governments as well. Like one of the things we always talk about is, my gosh, like in government, you still see jobs for the mainframe. I don't know who's doing mainframe and why are we not moving away from this 30-year-old technology, right? So it's little easy things like job descriptions need to get adapted to where the future is headed. And when we talk about future, the future is now. So how about we take little baby steps to improve these things so we can truly be an augmentation layer and not a replacement layer.
Yeah, I agree. That makes a lot of sense in the way we need to look at this through that lens and really preserve what's within our societies. When we're looking at just the greater benefit, AI as a computational tool, science is just entering into healthcare faster than we can understand, and it changes the way we think. If your grandparents were clinicians and they would think through a medical process, right, for a patient or for the panel of patients they manage, introducing EMR, just that whole digital interface has changed what we think and the way maybe we're a little bit more ADD in the way we operationalize. So as it's going to continue to change possibly in the way we think about this, are there concerns as we're accumulating more and more data that we run into sort of a data security issue and then that we're part of that problem? Do you see that happening in your field? And does it strike on a moral chord? Ivy, do you want to start with that?
I can. So, I work with a lot of government agencies, not just in the US, but across the globe. And there's just an inherent distrust in government, regardless of what you do or not do with the data. And I think that has to do with the political climate, everything else that's going on. So I think addressing that is probably how we utilize your data and providing that level of transparency is extremely important. Because sometimes you're like, hey, I'm putting all my stuff in there. Where does it go? Who is it being used by? Are these LLMs using my data to train the model? Or are you using it specifically within your agency? So I'm having a lot of these conversations, and mostly, honestly, it's around governance. It comes back to data governance and AI governance. And I think people are asking for that transparency layer from a lot of different, not just government, but even educational institutions. It's like, how are you collecting it? Why are you collecting it? What are you going to do with it? And I need that transparency layer, especially now than I've ever had before.
Got it. And Furkan, do you see same issues maybe at a corporate level and even just personally, how do you feel about having all that data at your fingertips?
Yeah, I mean, it's really good and bad at the same times. I think I touched a little bit on it previously that great to have all the patient data we have because then we can build personalized models which can ultimately help these patients. But then if you look at the neurotechnology perspective, all these consumer neurotech companies who have your data, there needs to be regulation around what they can do with your data and what kind of ownership they have. So better laws need to be made around that. I think it's a new field. People are still basically arguing and brainstorming as to what should happen. There's an interesting example where I think Meta recently came up with a brain model, which basically looks at brain activities of a lot of people. Yeah, they collected a lot of brain data, and then it can predict what kinds of ads would be the most attractive to you. This basically recently happened like that a month ago or so. It's interesting that you can do that, but then once you hear of these kinds of applications, it even calls for more strict regulation as to how this can be deployed and how it will be used ultimately by an industry. And so, yeah, it's interesting to know the kind of stuff that can be done and how we should regulate it.
I agree. Thank you. And Fatma, do you have thoughts on that?
Yeah, I mean, it's an important question. Something that's likely to be underestimated because it's less visceral than bias and less philosophical than explainable. There will be times when you have a concrete failure that happens, and by the time that happens, it's kind of too late. Like even my own data being contributing to these models. On one hand, the reason we have these great models is because there's thousands of data points that have allowed these models to get to where they are. But at the same time, when you're talking about patient information, like that's really private, that's really personal, and that you want to make sure stays safe, it's really tough to say. Like, say you gave consent for an AI company or someone to use the data today. Maybe you'll know how it's being used today, but I don't even know if the AI company knows in 5 or 10 years how that data is going to be used. And so part of the consent process of it, like enrolling patients, if their data is going to be involved in AI, saying, this is how the data is being used now, but we don't really know where it's going to be in 5 years. Being honest rather than being like, oh, I have a crystal ball and this is what the future is going to look like. I think that's really not the answer. It's like, this is how it's used today. We don't really know what the future holds, especially like sitting in academic settings. A lot of times patients are like actually excited to share their information if they feel like it could help other patients. And that spirit is still there. And people are going to willfully share some of that information. But we as clinicians need to be stewards of that data so that if it is being fed into these things, we're asking some of those hard questions, making sure we bring patients to the table so they're able to ask those questions. But I think the most honest answer would be like, we don't know. Like, this is our hope of how it's going to be used. But anyone who said, this 100% is how it's going to be, it's tough to say because I don't know how much lasting power there is to what we say today for tomorrow because we just don't know how these models are going to function in 5 years from now.
I presume you also collect a lot of data in your
Yeah, we
patients.
do. I don't have honestly too much to add here as it pertains to data security. I will just say medicine and medical research is one of the most heavily regulated areas in our economy and society in general. Appropriate concern for data security is crucial. I think balance, careful review of research methodologies with potential delay and innovative solutions for patients.
Right. And I think we have a question here from Sohail. And I'll go ahead and read it and try to summarize it. It says, patients in current climate are smart consumers. Is it fair for clinicians to ally or get assistance from AI as knowledge refresher on clinical translation while maintaining clinical judgment? Overall, this alludes to, as a clinician, tasked with doing what's best for your patient. But then, we all know in our practice world, we have a lot of noise, right? We have insurance companies telling us what to do. We have institutions, we have peers and societies telling us what to do. And then now we have this other layer, if noise, if you call it, whether or not you consent to that, if you're part of an employed environment where everyone's using it and you have to also use it, that puts you in a precarious situation, right? So it's like Jarvis telling Iron Man, yeah, do this. And so how do you tackle that piece and knowing that you want to be fair and transparent with your patient, looking at it from a clinical lens? I'll start with Fatima, just as a clinician, how do you address that?
I mean, I know my patients are coming in looking at ChatGPT or Claude, and then they're asking me questions like based off of that. Like, I had someone who came in for a ablative CO2 of the face. I could see from the formatting of what they had printed out, like it had been produced by Claude, and it said, "Please, will you ensure that you'll like avoid my medial canthus?" And having done this for several years, I'd never gotten that question before, and I could tell it was something that Claude had made. Now, I applaud the patients for coming in with those more sophisticated questions. And I think that's really important. And I think because they're coming in with those questions, we are almost like obligated to make sure that we are also are up to date with what's in these tools. What are these tools spitting out? What is the type of thing? Because I was surprised by I could see where the questions were coming from, some of the bullets. But I was like, oh, I'd never even thought of it that way. And what I started realizing is a lot of these questions, especially recently in the past 6, 9 months I've been getting, are probably produced from these AI tools. We should actually go on ChatGPT and Claude and ask it some of the questions that our patients might ask so that when that question inevitably ends up in front of us, we're prepared. And I will say, when I've spoken to more senior dermatologists who are very seasoned, they say kind of one of their major priorities now is making sure, as part of continuing medical education, that we're training some of our more seasoned colleagues, like how to interact with the AI, but also how to figure out what kind of questions patients are coming from specifically from the AI because they see these trends and is this coming from social media? Where is this coming from? And as they're getting more and more of these questions, they're realizing it's because like ChatGPT keeps spitting out the same question about this specific diagnosis or procedure. And so I guess that's all to say. I think it's a great thing for us to be on these platforms. I don't think we should be like putting patient data in there. We should be interacting with these tools day in, day out. So we know the kinds of things that it's spitting out so that when our patients in front of us, we're not caught off guard. We know how to answer the questions that they're asking us.
Thank you. Red, do you see something similar with your patients?
Oh yeah, absolutely. And among clinicians too. I mean, I think as of April, about 67% of doctors are using open evidence, go domain specific LLM, right? So we're using it. I personally would love like an ambient AI to sort of watch my clinical encounters and maybe even give me feedback in the moment or even after, like, hey, just FYI, the patient asked you this question and you didn't really address it in your response, or you may have cut someone off there, or maybe you could have been a little bit more empathetic here. That would be great, and it would be almost like a coach and get me to be a better clinician.
And Furkan, I know you have field engineers who go out and make suggestions, not recommendations per se. How would it look if they were paired with an AI?
Definitely, that's a really interesting application. And I think the field in general is moving towards that in the next 3 to 5 years. Once you have a lot of this data pertaining to individual patients, different industries in the neurotech or neuromodulation sector will start building their own kinds of these recommender systems, AI chatbots or agents who can help these kinds of either field engineers or even physicians tailor therapy based on what kind of data has occurred in the past. And I think with my, I'm not a clinician, but I've had some interactions with patients in the past. And so I've seen like a diversity. There are some patients who are just, we don't want to look at our data, but then there's an increasing number of patients who really want to get into the data. They want to see what their brain rhythms look like and what they mean, which is very good. It's good that they want to basically take ownership of their data. But then basically what that means is we, as an industry and even in academia, we need to be building tools which have guardrails around this. When a patient asks about their data, the tool is transparent. It tells an honest picture of what's there, but then also with guardrails as to it doesn't say wrong stuff that it's just not competent in, and has proper disclaimers that I don't have much knowledge about this, so you should consult your clinician. The industry needs to develop tools like this much more better as compared to where we are right now.
Thank you. And Nadia, so in the government sector, I know they're open to consultancy from private side. Would this be something they would be open to, or you think you would run at odds?
Yeah, absolutely. It's funny, all the stuff that you talked about is so true. So I host a lot of community focused workshops as well as part of like the AI education that we do across every region. And I always start with personal adoption. We never talk about software. It's about what's the end goal that we're trying to solve for. And I always start with what's the one hack that you've been using in your day-to-day life that you just want to share. And the number one use case, believe it or not, it doesn't matter which region I'm in, is around healthcare. It's like, oh, I put in all of my health information in any of these open free models so I can go and ask my doctor, like, hey, am I on the right path? Or you know what, I even put in my labs in there and have it tell me before I have to go and talk to the doctor about it. It's just such an interesting time that we're in where people are afraid from a privacy security perspective, but at the same time, people actually don't realize you're putting in a lot of your very sensitive personal data in. So anyway, I just find this interesting in the era that we're in, especially in the healthcare, because people are using it more for mental health, therapy. They kind of have a therapist coach at all times. They don't want to actually go to a real in-person coach anymore. So anyway, there's just a lot of interesting use cases, but I'm happy to kind of share in terms of data governance strategies, adoption strategies, because you have to bring people on this journey with you. How do you do that? Because you have a lot of senior folks, a lot of tenured folks who just like, I don't want to change. And this is a massive change, regardless of the industry vertical that you're in. So yeah. Now, thank you for having me. This has been a very conversation just for me as well.
Yes, and since we're at time, this is an ongoing dialogue. And that's where platforms like AMP are great, because then we can continue to connect, share ideas and thoughts, and engage with one another. So I encourage everyone to do that. I'd like to thank AMP, our host, for putting this together, and my moderator, Amir, and the panelists. Thank you for taking time off your Sunday to be here to join us.